So just briefly on some cancer development, normally if you have early stage cancer, the main treatment of choice is surgery. By removing the cancer from your body, there's very low risk of you having any more cells. Unfortunately, sometimes microscopic small cells may have spread and hidden in other parts. CT scan cannot pick it up. And that's why we worry about recurrence. So for some cancers like lung cancer, after surgery, on the scan you're clear, we advise chemotherapy. Then the patient will ask why. The reason is lung cancer is so aggressive, some small cells are hiding elsewhere, micrometastatic cells. And the chemo will go and kill those cells. So your risk of recurrence reduces. Okay, and we can also use radiotherapy, but one big part of cancer care is actually psychosocial support. Patients who are undergoing cancer, they will have a lot of emotional distress, mental distress, and financial distress as well. Many ways I think there are financial help available, but with the newer therapies, unfortunately, there's very little help. So sometimes we may need to use other drugs that are cheaper. Hopefully in the future, with better insurance coverage, this may not be an issue. Now, what I mean by new therapy, last time chemotherapy is like a cluster bomb, it's like a nuclear bomb that come, kill 200,000 people, and then not just the bad guys, even the good guys, women, children also end up getting killed. Now, the therapy is a bit better. It targets more of the cancer cells, less of the good cells. What are the good cells? Like hair, for example, right? In the old therapy, you will have a lot of hair loss. You have other things like weakness, tiredness, joint pain. Now with the newer therapies, you may have some of that, but the peripheral effects are less. You won't get, in fact, many of the targeted therapies, no hair loss. Although some of it is slightly different. Some of the new therapies may turn your hair white. In fact, there's one therapy I use in kidney cancer. My patients love very much, especially the females. Your skin becomes very smooth and white. And then many of them, their friends will ask them, what treatment you use? And then they tell them, oh, kidney cancer treatment you want? But then the answer is no, nobody wants kidney cancer. But the new therapies have a different side effect profile, right? So times have changed. Here you can see somebody with lung cancer, and these are cancerous cells. This is heart, this is the heart, this is normal. These are the cancerous cells, these three here. Then 4 months later, very quickly they can actually disappear if you have the mutation. So nowadays we've gone into molecular cytogenetics. We do not just look at what are cancer cells, we go deep into the cells, we sequence the DNA and find out what is the mutation, and we have a drug that specifically targets the mutation. So I mentioned prostate cancer. So colorectal cancer also, the main treatment is surgery. Stage 4, we give palliative chemo. Palliative chemo means chemo that can prolong your life, hopefully also improve your quality of life, but it may not cure you.